Back pain specialists are invited to Cox Seminars. Hands-on back pain specialists know that treatment protocols are not learned by watching. They are learned by doing, by being guided by an observant instructor, by being monitored with force feedback systems that measure proper force application, by being open to correction. Having said this, we'd like to share a few things that happen at Cox Seminars, particularly at Part 3 courses where evidence-based practice principles merge. Research, clinical expertise, and patient preference, which becomes particularly clear when you take a turn as the patient during hands-on practice sessions. At Cox Seminars, new information abounds. The latest research, often meaning the latest published spinal research from the day before the seminar, is shared. Dr. Cox reads spinal research daily, often for hours a day, and incorporates these details on spinal care into the presentation and ties them to historical facts when appropriate to show a better way to alleviate back, neck, arm, and leg pain and other spine-related issues. Presentations by experienced colleagues who share their clinical observations are featured. For example, you might be introduced to the distraction decompression of hip and knee degenerative changes on the Cox instrument, like Dr. Albano did at a recent Part 3 course. You may learn more about a seemingly rare condition like Ehlers-Danlos that may not be so rare and shows some relief with chiropractic care, as Dr. Yoakum recently shared. You may observe Dr. Cox as he shows the Newton force application in the proper execution of flexion distraction decompression of spinal stenosis. You will work with the force table version of the Cox 8 table by Haven Innovation to learn the forces that attain best clinical outcomes. You will visually see the forces you are applying to the disc herniation, spinal stenosis, spondylolisthesis, transitional segment, facet syndrome, and others so that you know how to attain the evidence-based clinical outcomes described in the published studies and that you want for your patients. You will learn how nutritional deficiency influences disc degeneration, osteoporosis, edema, and how to use nutrition to enhance your clinical outcomes in spine pain patients. You'll hear a bit about the importance of exercise and even new approaches like doming of the diaphragm for hamstring stretching, so necessary for conditions like spondylolisthesis, and exercise not just for strengthening, but encouraging patient involvement in his or her care. You may well learn how the chiropractic adjustment positively influences the cycle of inflammation through afferentation. Evidence-based clinical outcome depends upon proper examination and diagnosis preceding the design and implementation of any treatment plan. At Cox Seminars, you'll see Dr. Cox's system of spine examination for implementation into your clinical protocol. You'll also have a published algorithm of decision-making based on your clinical exam findings to establish that treatment plan and guide the care from the number of visits to the type of care given at each visit to the appropriate protocol for dismissal from active care. Adaptations of treatment protocols are also shared. You may well learn the sideline Cox procedures for those patients in too much pain to lie prone, those who are pregnant or have conditions like scoliosis and others that better respond to less forceful, low velocity, variable speed spinal manipulation. You may even see some supine adjusting adaptations for certain conditions. You'll also learn to adjust and/or cavitate thoracic spine segments without forceful vector thrust, which is not tolerated by a growing segment of patients seeking your care. So we share this information not as a this is how you do it, but rather an invitation to come learn Cox Technique protocols properly in a professional environment, suitable to learning, experience, and honing the skill to meet the clinical outcomes documented in published literature. We look forward to seeing you at a Cox seminar soon.